Hello, and welcome to the first episode of Between Two Bushings. I'm Bryce Dugan, your humble host. Thank you for spending the next couple of minutes with me. Before we get started, I don't want there to be any misconceptions. Let me give you the 5 whys of why not to get your hopes up for this show. First, I'm not Zach Galifianakis. Number 2, I don't have any rich celebrity friends to invite on as guests. 3, we have absolutely no budget. Number 4, this is a Canadian broadcast. And number 5, this is my catering budget. Now today, we're going to take a look at Canada's healthcare system and some of the misconceptions our U.S. neighbors have of it. If you're an American watching this, I just want you to know that yes, there is a country north of your border. And no, we don't use dog sleds as ambulances to take us to our igloos. Or take us from our igloos, I guess, Now, if you're a little more informed, you may know that Canada has a universal healthcare system. I've heard it stated many times that this is a free healthcare system. Well, let me explain to you that this is far from free. First, although our healthcare is available to anyone in the country, it's anything but free. Canadians pay on an average of 20 to 35% income tax. It's all based on how much you make and how much the government decides to take. This does not mean that the more you make, the better your healthcare is. And the less you make, the more subpar your healthcare is. It's one system for everybody. In addition, our average wait times for elective surgeries can take up to 12 months. This is why many of us decide to go to the States and pay to have our surgeries completed. Our emergency rooms are very overcrowded, and you can wait anywhere of up to 5 hours even before you're seen. Also, dental is not included in our healthcare system. If it were, we would all have Hollywood smiles. Unfortunately, most of us have smiles like these. Can we cut to the hockey player? Cosmetic surgeries are also not included in our free healthcare system. Once again, if they were, the majority of us would all want to look like this Canadian. But unfortunately, we all look like this Canadian. And if it were up to me, I'd want to look like this guy. Although our healthcare isn't free, the majority of us Canadians would not change where we live for anything. We enjoy having the ability to visit a hospital when we want, to see a doctor when we want, and get the healthcare we need whenever we want. Thanks again for watching Between Two Bushings. I'm Bryce Dugan, your humble host. Please feel free to visit our website at any time at www.bearingbronze.com, where you'll also find photos posted of our ruggedly handsome staff. Should I even put that in? Next week, we'll be talking religion. Canadian religion. That's right, hockey. Please share with your friends, tune in, and increase my budget. The more likes I get, the more money we have to spend on this shitty